Cebu, kumusta Filipinas? May gabi. Matud ba mo nga og makuyapan ka maglain ng kabuhi tungod sa stress? Dunay hinungdan na dili na sa imong utok, dili na sa imong attitude. I will explain that to you. I'm Dr. Raul Enad from Cadenza Medical Clinic, Ave Maria, Florida. I'm a specialist in internal medicine. I want to serve you. I want to connect with you. So hang on till the last minute of the video. I will explain. I-explicar na ko kung ngano ang makuyapan or lightheadedness. For the English speaking, I'm talking to my Visayan friends in Cebu or all over the world. So bear with me, but I will make it balanced to speak English and Cebuano, maybe Tagalog. So let's start. Dunay pasyente na ako. I have a patient who comes in. She said, I'm tired, I'm exhausted. Gikapoy na ko, kuyapan ko. She comes in, blood pressure was low. And sometimes the blood pressure goes up. We call it erratic blood pressure. Those are early signs of autonomic dysautonomia. I'm sorry, why Bisaya sa autonomic dysautonomia. I will explain that to you. Explicar na ko. Ang tibuok lawas, the whole body, is innervated by the vagus nerve, the autonomic nervous system. Is controlled by the autonomic nervous system, all the functions. Ang utok, when you're thinking, the gastric acid, ang sa imong tiyan, ang imong stomach for digestion, acidity. Ang kasing-kasing, kung ano magpalpitate, ang blood pressure, ang sugar. These are controlled by the autonomic nervous system. There are two branches. Dunay duha ka branches sa autonomic nervous system. And I'm sure na kibaw mo on sini. These are the sympathetic tone and the parasympathetic tone. The sympathetic tone is what you call the fight-flight. The parasympathetic tone is the rest and digest. Easy to remember. But what is the significance for this? Kung duna kay pamati nga you are feeling lightheaded, kakuyapon ka, and yet your blood work is normal. CBC, no anemia, hemoglobin is normal. Usually hemoglobin is about 13, 14, 12. No, usually laboratory reports it's 13. Ang thyroid mo is normal. Your blood sugar is normal. Your heart rate maybe is normal. Blood pressure sometimes is normal. Sometimes it goes up. But you're still feeling crap. Gikapoy ka, kakuyapon. Panington. You will be sweating. Panington ka bugbog. And then you feel these heebie-jeebies in your stomach. Mura ka gikabuhi. In my Visayan dialect, we call it gikabuhi. This is a prodrome of having to collapse. There is an explanation. Doon na explikasyon na. Usually, og normal ang tanan, EKG, echocardiography, like ultrasound of the heart, wa kay anemia, ang thyroid normal, blood sugar is normal. Sometimes you get dehydrated. But ngano, why do you feel crap? You feel exhausted. Acutely, this is not happening just out of the blue. This is because stress is doing this. Stress from multiple days, weeks of stress, or even years. This is attempted to be explained as polyvagal theory of the nervous system. This was proposed by Borges in University of Chicago. And it's very interesting. Let's define stress. Stress could be you're thinking about something, preparing for exam, you're in PhD program, 6 years medicine, sleep deprivation, wakakatug for many days. And that happened to me also when I nagtrabaho pa ko as a hospitalist. Why katug for 7 days, for 7 nights? Ang ubang mga amiga na ko, so mas maayo pa man ang ang firefighter kay papahuayon og usa ka gabi ng way tug, the following day magpagkatugon. What I'm trying to say in English is that many made a comment that observing us sleep deprived for 7 nights, but it's better to be a firefighter because usually they get to sleep the following day after 5 nights, 1 night of sleep deprivation. Sleep deprivation, o way katug, is the number one cause of stress. Don't go anywhere. Second, when you are caring for somebody, caregiver ka, you have usually you're thinking so much, you are emotionally involved. Sometimes you get sleep deprived, way kay katug, maka-cause na stress. Ug doon na kay lisod nga relasyon, importante na siya. For those who are viewing, please drop a comment. Say where you are. Hopefully, we can connect with each other, and maybe drop a note. Say hi. I'm in Ave Maria, Florida. I don't know where you are at right now, and it's good to connect. But going back to the topic again. So doon kay pasyente, I have a patient who is probably 70 years old, female, very nice woman, big heart. Very giving. She was taking care of a husband who was chronically ill, gradually becoming ill for the last days of his life, and they got married early, but lately, doon na siya symptom nga lightheaded siya, kakuyapon siya pirmi, suddenly she would feel like she has this feeling of acid gushing to her stomach or some emptiness. In Cebuano, we call this kabuhi. And sometimes her blood pressure goes up and erratically it goes down. These are symptoms of sympathetic or autonomic dysautonomia. So how did she get through here? She told me. She got married early. And then what happened was the husband was a little bit disconnected with her. In fact, she demeans her, according to her. The woman was complaining. My patient was complaining that she always was made. She felt like she was not important, including the in-laws. She was essentially the in-laws. Eventually, mga umagad. Were telling her that she was responsible for him becoming so sick. Kay wa niya timana ang iyang bana. Things like that, those comments. That's just lower down your self-esteem. So what happened? What's the relationship with the symptoms of having some lightheadedness, fainting spells, kana makuyapan ka? Borges, a scientist, explained this. There are two branches of the vagus nerve. Well, the vagus nerve is the innervation of the autonomic nervous system. Just hang on. I-explain ako. Kaya importante ni siya. So the ventral is a safe haven. Like you're resting and digesting. Padayon ang pagkinabuhi. Padayon ang gibati. However, if you're threatened with something threatening, like fear, fight, then immediately you feel this gush of feeling in your gut that you want to fight or to leave. And through the process of defenses, sometimes you feel like lightheaded, and the decompensation, you collapse, you faint. So what happens? It goes to the dorsal branch of the vagus nerve, which activates the area of the vagus nerve where the dorsal branch is consistent with low energy, heart rate goes down, and eventually decompensates, your heart rate goes up again. You're feeling numb. Murag electric ang imong pamatis, imong mga, what do you call this, imong extremities. And you tend to withdraw from others. The more, it gets worse. And you feel fatigue, gikapoy ka. Fatigue is not necessarily saying that you're short of breath. No, you're not short of breath. in fatigue. You just have reduced energy. You have reduced motivation. And exactly my patient who presented to me is, yes, I am just exhausted. Ikapuy na ko, doktor. And then the worst thing, you collapse, you faint, and the workup goes. Sometimes they bring you to the emergency room, check your blood sugar is normal, check your hemoglobin, no anemia, the EKG is normal, and then you're sent home. Then the worst thing is you're sent home without any intervention and even exploring why this is happening. So that's the response of the dorsal vagal branch. When you're perceiving fight, flight, when you're receiving stress, when you're receiving threat, imagine, baka nahuna unconsciously, subconsciously, the mind of this patient was receiving signals from the amygdala saying, you are good for nothing, you're to be blamed on these things. And when you hear this, when you're reminded of these things, it goes back to memory, to the amygdala, which is a center for anxiety, depression, and anger. It goes back, it reverberates all the time. Cortisol goes up, that's the stress hormone. The stress hormone is responsible for increasing the blood sugar. The blood sugar will stimulate adrenal glands so that the adrenal glands responds to fight. The norepinephrine and epinephrine goes up, and your blood pressure goes down. Or the blood pressure goes up, and then there goes the fluctuation of the blood pressure. The worst thing is if you're dehydrated, ug dili ka mo inom pirni, ug tubig, ug fluid, it will get worse. Ngano? Because the center for the sensor for pressure is very sensitive. If you have low volume, the center for the carotid sinus receptor, which is the volume receptor, will not be able to regulate this. They will not be able to control the blood pressure such that the blood pressure doesn't go up, and then your system shuts down, and then you collapse. Your blood pressure goes down again. So it's a cycle of all these things, but it comes from stress. Stress from many years of suffering, or even acutely, that can shut down activate the dorsal part of the vagus nerve. Remember, the ventral part, or ang ibabaw, partes ibabaw sa vagus nerve, needs to be activated. And how do you do that? Guided breathing and meditation. That is the reason why mangadji ka og rosaryo, makatabang nimo sa imong episodes of collapse and fainting spells, because you are toning the vagus nerve. I'm trying to reach out for my rosary in my pocket. Just bear with me. Because this rosary is very helpful, not just from the power of the rosary as was promised by the Virgin Mary, but there's a science to it. Dunay science. Dunay publication that was published in the British Journal of Medicine comparing the rosary, effect of rosary, and the mantra, using the mantra of the yoga. So what they did was to make the patients pray the rosary, do the mantra instead of some mantra of the yoga about different the gods of Hindu, which is not allowed in our Catholic faith. So they said, Ave Maria, gratia plena, Dominus tecum, benedicta tu in mulieribus et benedictus fructus ventris tui, Jesus. Sancta Maria, Mater Dei, ora pro nobis peccatoribus, nunc et hora mortis nostri. Amen. Well, thank you, Kelly. So this, they made them recite the Ave Maria, or the Hail Mary and Ave Maria in Latin, to make it a uniform study. And you have to breathe 6 breaths per minute. Well, you think 6 breaths per minute is like not able to breathe, but it's really simple. 10 seconds is the cycle of the respiration, but you inhale 4 counts. 1, 2, 3, 4. Exhale 6, 5, 4, 3, 2, 1. So that's one cycle. That's 10 seconds. So you do that 6 times in 1 minute. So you have 6 breaths per minute. So that's what they did. They did 6 breaths per minute, 6 respiration, inhale 4, exhale 4. It has the same effect with the mantra of the Hindu doing yoga meditation. So why go to yoga when yoga is actually a portal of entry to the devil? Because the yoga meditation is all about self. Self is pride. It's about you. When you talk about you, that's pride. That's the friend of the devil. That's actually, Kelly, it was actually Father Stanish who enlightened me about this. That's exactly the pot syndrome. Yes, when he was, yes, that's actually an autonomic dysfunction because the vagus nerve is not toned. So it's like toning the muscles. You have to exercise every day. So the vagus nerves to be toned every day. So what happened to me in Valparaiso when I was in Michigan City, I was sleep deprived for 7 nights in a row as a hospitalist. It caught up on me. My heart rate went up, it goes down, and I felt lightheaded. The first intervention I did, I discovered painfully through anti-aging conferences, A4M, which led me to a specialty of functional medicine. They taught us meditation. So I said, meditation, yes, that's great. But I'm concerned about doing meditation because I don't know how to meditate as a Catholic. Well, it turns out it is in the catechism. The catechism of the Catholic faith encourages us to do meditation. And there are 3 phases. One is to adore and ask forgiveness. That's the first phase. So you can start your meditation that way. When you breathe in, inhale, you exhale 6. That's one cycle. But when you inhale, incorporate the breath prayer or the Jesus prayer. When you inhale, you say, Jesus, Son of the living God. Exhale, have mercy on us sinners. You do that 20 times. That's about 4 minutes. But you breathe. Breathe in. Have mercy on us sinners. Jesus, Son of the living God. Exhale, have mercy on us sinners. When you do that, you are actually activating the heart rate variability. The variations is such that when you inhale, the heart rate goes up. When you exhale, the heart rate goes down. That's when your heart is more calm, your brain is calm, the gut especially is also calm. When you have that variation, multiple variation per second, you have increased your heart rate variability. So the heart rate variability is this. You can measure this by any gadget like a Fitbit or Aura ring that I use. When there's increased heart rate variability, you're set more on the parasympathetic tone, or you're activating the ventral branch of the vagus nerve, which is resting and digesting. You have to keep this steady so that if there's a stress, then if there's a threat for something, whatever it is, a remote past of trauma, smelling something related to a trauma, then you feel lightheaded, you faint. That's because the polyvagal branch of the vagus nerve intervenes, overcomes the ventral, which is weak, then you faint. So by doing guided breathing in and out, using the breath prayer, Jesus, Son of the living God, have mercy on us sinners. So you do this 20 seconds, 20 counts, in the morning, because you're resetting the cortisol that is up, elevated at night with the diurnal rhythm. And the stress through the day before you go back to lunch, do this again. And at 3 o'clock, you can use the Chaplet of Divine Mercy. When you say, for the sake of your sorrowful passion, have mercy on us sinners. You inhale, for the sake of the sorrowful passion, have mercy on us sinners. This will reset your sympathetic tone or tone your ventral vagus nerve, that you're resting and adjusting, so that there's a stress that the dorsal branch of the vagus nerve, which is fatigue, associated with fatigue, low energy, palpitations, will not supersede, and you will be adapting to stress. What about the rosary? It had been proven in one study that I told you earlier, in the British Medical Journal, it was published. They compared people who did the rosary and the yoga. And they compared the outcome on the heart rate variability. Remember, the heart rate variability is when your heart rate variability is up, when you do guided breathing, it is associated with the parasympathetic tone. That's where you need to be, so that when there's a stress, you can react promptly and not collapse. You don't hide. You just absorb your nutrients. But you have to breathe slowly. 6 breaths you have to regulate, because if you notice, if you're breathing fast, you're not oxygenating your brain. So the tendency is you can get lightheaded. Try breathing fast, and then eventually you will get lightheaded. You will collapse. But if you breathe slowly, inhale 4, exhale 6, and you pray the rosary, Ave Maria, gratia plena, Dominus tecum, benedicta tu in mulieribus, et benedictus fructus ventris tui, Jesus. Exhale, Santa Maria, Madre de Dios, ruega por nosotros pecadores, ahora en la hora de nuestra muerte. Amen. I think I prayed Spanish on the second one. I got confused. But anyway, that's the idea, that you have to pray the rosary every day so that your vagus nerve will be toned or strong, ready to fight. Pray the rosary with breathing, meditating. Father Leandro, my spiritual director here, said to me, he's a priest of Opus Dei, that the rosary is not about the Hail Mary. It's not about the Virgin Mary. It's about Jesus. Well, the Virgin Mary recommended this to fix wars and heal and allow healing, because we know that if we pray the rosary, we're actually meditating and getting close to Jesus. Because come to think about this, even the joyful mystery talks about the Annunciation and the first mystery. The Annunciation talks about the response of the heavens when Adam and Eve forgot about Jesus. They were so prideful. They were tempted by the devil and they yielded to temptation. So then humanity could not have been saved, but they planned Jesus to come to the world through the vessel, the immaculate womb, the vessel, that he would come to the world. That's the Annunciation. But it's a forecast of what is to come. It's his unconditional love for us through his passion. So if you start even with the joyful, you will live through, you will meditate through his unconditional love for us. The more you meditate on this, the more you get closer to him. Just like having a friend. The more you talk with your friend, the more you know about his life, his friend. Jesus is our friend. And Hail Mary is just the rhythm. Thank you, Joseph, for watching. Hail Mary is just the rhythm. But of course, you pray it slowly. But you think about the mystery. Each Hail Mary, you breathe, exhale, so that you only have 6 breaths per minute. Inhale 4, exhale 6, so that in 10 seconds, you have 10 seconds in 1 minute, you have a cycle of 6 breaths per minute. And you synchronize that with your Hail Mary. That's the beautiful Hail Mary that the Virgin Mary asked even before the apparition in Fatima. In Quito, Ecuador, the Virgin Mary revealed to a farmer saying that you should meditate on the rosary and not just dabble on the words. Worse would be to look around and say Hail Mary, and then you keep on commanding whoever, hey, don't do that, don't do this, or think about whatever, or doing the gadgets in the iPhone. Focus. Think about the mystery of the Holy Rosary, each mystery. That is healing. Together with the breathing, it will reset your vagal tone to the ventral part, which makes you rest and digest. And dili ka makuyapan, you will not faint, you will not have lightheadedness, and you're ready to fight. You're ready to, not fight, you're ready to endure stress. So if you reset your body through the day, early in the morning, before you go to lunch, at 3 o'clock, the Chaplet of Divine Mercy, and before you go to home, do this, even 20 repetitions of Jesus, Son of the Living God, or better still, you go home and pray the Rosary with your family. So hopefully, I don't know if this is Joseph or Kathy watching me, but it's a good idea to pray the Rosary with your family every day so that everybody in the family will be healed, and through the night, you will be protected by the power of the Holy Rosary. It also resets your brain. It also resets your gut. The gut has been shown that if you meditate, no studies directly on the Rosary effect on the gut, but you can extrapolate that if you meditate, if you pray the Rosary, the population of the gut changes to make it a healthy looking gut that will also support. Imagine a microbiome that would increase serotonin, for example, that will make you feel happy. Imagine the blood, what do you call this? The gut that stimulate the gut to produce GLP-1. What is GLP-1? GLP-1 is the substance or the peptide that will make you decrease appetite, delay the gastric emptying, improve your insulin function, and in one peptide, GLP-1 is a terseptide or Monjaro that would melt the fat. So you have a naturally occurring GLP-1 that is produced if your gut is improved, the microbiome is improved through meditation. That I can say that meditation makes the gut microbiome healthy. So indirectly, meditation can help not just a sympathetic tone, but also the microbiome, but they are related. If your microbiome is not healthy, the vagus nerve that innervates the autonomic nervous system, that also innervates the gut immune brain connection, see the connection, will be healthy. So the power of the Holy Rosary cannot be underestimated. Pray the Rosary, not just for prevention of war, but to save your body from stress. We all have stress in life. Relationships, work, administration. Kathy's problem, what's his name? My friend here in Chicago, probably his problem is how to count his money. That's a big stress, no, Kathy? I'm just joking. But Kelly will have also other problems. I'm sure they can share. I know my friend Kelly who's watching. So this is the facts. Rosary is powerful, not just from the appeal of the Virgin Mary, which is a big concern of the Virgin Mary to avert war, but take it personally from you. It will make you physically healthy, emotionally, immunologically healthy, just by the power of the Rosary, backed by science. So if you like this video, please subscribe to the YouTube channel and also for the Facebook. You will be informed on more discussions related to medicine and faith. Share it to your friends. They might benefit from this. And hopefully we can see each other again tomorrow at about the same time on another topic. So have a good day for now. I have to go back to work. It's a beautiful day in Florida. And I just heard the 6:30 Mass. So I'm ready to go. Thank you very much. Goodbye. Thanks for watching, Kathy. Thank you for watching, Kelly.